Here we are, the last chapter of the module, chapter 55, sexually transmitted infections. So, sexually transmitted infections, or STIs, are a serious public health problem in the United States. In fact, an estimated 20 million new infections occur each year, and half of those are in persons ages 15 to 24. Now, these infections are spread primarily through sexual contact and may have serious and permanent consequences, as you'll be finding out as we go through each infection. Some people resist taking preventative measures to prevent infections, and that's probably because they don't have the knowledge. So it's important as nurses that we share the knowledge with others so that they can be aware. Infected people do not always inform sexual partners, and so the disease continues to be passed on from person to person. And as nurses, we must be aware of the patient's feelings about their STIs, and we need to know about our own feelings about taking care of these patients. We cannot be judgmental. We need to be very neutral, but we need to know how we feel about these sexually transmitted diseases. But we can feel any way we want to, but we can't project our feelings on our patients. We need to take care of everyone equally. That's really important to remember. So some diagnostic tests and procedures that can be done on these individuals who engage in high-risk behaviors are some lab tests such as hepatitis A, B, C, D, syphilis, which is a VDRL. Maybe you've seen that on some of your patients' lab tests, because some of the elderly patients may have been exposed to syphilis when they were younger. Now you don't see it as much today. HIV, Herpes Simplex, and Cytomegalovirus, or CMV. Now these tests and procedures can be done and tested with smears, swabs, and cultures. So gonococcal culture, herpes simplex, trichomonas, and yeast infections are all done with cultures and smears. To collect from the female, you would take a swab or a culture from the cervix or vagina, and really that would usually be the physician, right? To collect from the male, we would do a swab or use a special loop going through the penis, which after seeing the male anatomy, we know that the penis not only is for urinating, but it's also a sexual organ. Be sure to wear gloves, as we always know that is true. So pathophysiology, this is interesting. There's 30 different bacteria, viruses, and parasites that are known to be transmitted through sexual contact, but the World Health Organization, which has come under a lot of controversy lately, but the WHO identifies 8 that account for the greatest number of infections, and that would be syphilis, gonorrhea, chlamydia, trichomonas, hepatitis B, HSV or herpes, HIV, and HPV, and we're going to be talking about each one of these. So on table 55.1, I'd like you to turn and we'll look at some of the drugs that are used to treat sexually transmitted infections. So if you look at the antibacterial agents, you'll see that penicillin G is the first choice for treatment of syphilis. And the next one listed is Rocephin, which is an effective against organism that causes gonorrhea. Tetracycline, such as doxycycline, is effective against organisms that cause gonorrhea in combination with ceftriaxone, chlamydia, and syphilis. Then we go to the next page. Erythromycin and Zithromax are also antibacterial agents. Then we get to some miscellaneous anti-infectives such as Flagyl. I'm sure you've heard of that. It is the first choice for trichomonas and bacterial vaginosis. Clindamycin, the thing that's interesting about that is a vaginal cream. It's used to treat bacterial vaginosis. But you need to advise, and then we need to go over to the nursing intervention here. So advise the patient that cream weakens latex condoms and diaphragms. And if you go back up to the flagell, notice in the nursing interventions, give with food or milk. And then the zithromycin, we're going back up. Caution if the patient has liver impairment. Do not give with antacids. Next page, we have dermatologic agents and the heart, which is the highly effective antiretroviral therapy agents. We're going to talk about that. So, confirmed cases of HIV, AIDS, gonorrhea, syphilis, chlamydia, chancroid, and viral hepatitis must be reported to the local health department. When I worked in the doctor's office, and maybe some of you who do work in a doctor's office, the doctor gets quarterly a list of confirmed cases in that particular county. It's listed by counties if there's any of these cases that are new. And of course, they have to be reported in order to be counted. So it's the nurse's or the doctor's job to report to the local health department. The investigator asks the patient to name sexual contacts. Those individuals contacted and advised that they have been exposed to the disease and encouraged to seek medical evaluation. Now that can be a tricky subject, right? Being informed by some stranger that you've been exposed to a disease, so that's why it's really important to be truthful to the partner. The process is to identify and treat infected people so transmission of the disease can be slowed. So let's talk about chlamydia first. It's the most common bacterial STI in the United States. Signs and symptoms, 1 to 3 weeks after being infected. Complications, if untreated, can cause sterility. Pelvic inflammatory disease. Medical diagnosis and treatment would be 7 days of Zithromax. And nursing care would be counseling. And I have to see table 55.2. There is a lot of tables in this chapter, so I'm going to keep referring you to them. They're very helpful. I think it's great that the chapter did this. So go to page 1087, and we'll look at signs and symptoms of the chlamydial infection. Sometimes no signs. Males have a penile discharge, thin at first, then creamy. They can have painful, frequent urination. Females have a vaginal discharge and lower abdominal pain. Possible complications, as we mentioned, can be sterility. Also transmission to newborn infants, causing eye infections or pneumonia. So that leads us to the nursing considerations. Counsel about the importance of treatment to prevent complications. Advise of the need for follow-up to ensure that infection has been successfully treated, and tell patient to avoid sexual contact until cured. Now, when it talks about babies, so this is if a woman has an infection when she's giving birth. It can, as the baby passes through the birth canal, can get exposed to an infection. All right, so counseling would be important here. So let's talk about gonorrhea. One of the most common reported STIs. Cases have been reported of transmission to newborn infants by infected mothers. Signs and symptoms. Well, let's go back to this. Transmitted through sexual contact, not toilet seats, doorknobs, or towels. So it's strictly through sexual contact, not by if that person has touched something else. Signs and symptoms occur 2 to 10 days after exposure, and the symptom would be discharge or burning. Complications, if untreated, can cause sterility and lead to damage to heart and joints. Medical diagnosis can be made by history, physical, lab test, smear, and culture of the exudate. And nursing care, now here we go. 55.3. So we've got gonorrhea. Signs and symptoms: men, thick urethral discharge, can be purulent green or yellow. Swelling and redness of the meatus, urinary urgency, and dribbling. Complications: epididymitis, urethritis, infections of the Cowper glands. As nursing considerations, we'd send the specimen to the lab for culture. Instruct the patient that all sexual partners should be treated. And be sure that the patient takes the full course of medication that was prescribed to them. And also stress abstinence or condom use so they don't spread the infection. All right, so that's really good, really helpful. Women, their symptoms are increased foul-smelling vaginal discharge, maybe difficulty urinating, fever, abnormal or painful menstruation, vulval soreness, peritonitis, backache, lower back pain. So be sure to counsel the patient about potential complications. So let's talk about syphilis. It's transmitted by sexual contact, but can be spread through breaks in the skin. So we need gloves. Pass through the placenta, causing congenital syphilis. So this would be in the blood, would pass through the placenta to the baby. Congenital syphilis. Signs and symptoms. The first symptom is a chancre, which is a reddish papule where organisms enter the body, and it progresses through 4 stages. So let's look at that on page 1088. So the primary stage is the chancre. The secondary stage occurs 1 to 6 months after contact. The latent stage, in which no symptoms exist. The late or tertiary stage, it can last 3 years after contact before late syphilis develops. Complications, they can develop potentially fatal complications, including neurosyphilis, blindness, paralysis, cardiovascular disease. What's interesting is that syphilis, patients who've had it when they were young have a special walk. It's kind of a toe walking. I wish we were in person, I could show you, but it's a definite walk that they have. It's affected them neurologically, obviously. Medical diagnosis is made through a lab test, VDRL, and medical treatment is penicillin, and they must complete the whole course. And that is again reinforced in your pharmacological capsule on page 1089. So herpes simplex. Herpes 1, simplex 1 or HSV1 is known as cold sores. Herpes simplex 2 is the genital STI. So herpes simplex 1 is not an STI. Signs and symptoms can be painful itching sores 2 to 20 days after infection, flu-like symptoms. Complications can be increased risk of cervical cancer, so have a pap smear. You may need a C-section to avoid transmission to the baby. So you can see how for women this can affect the baby. So what I wanted to point you to is if you look on page 1091, it talks about HSV can be suspected by the appearance of the lesion. No cure exists, but the oral antiviral drugs Zovirax and Vamir help by partially controlling the signs and symptoms. So as you know, cold sores, that is not, and it talks about that if you go to page 1089, the virus that causes cold sores, herpes fibralis and herpes simplex 1, was first described in AD 100 and transmitted through contact with open lesions. Nurses should use good hand washing technique when caring for infected persons. So the genital herpes is HSV2. Okay. Trichomoniasis. So signs and symptoms is a frothy yellowish discharge. And it's important that the patient and sexual partners be treated at the same time to avoid reinfection. And that treatment would be tinidazole or Flagyl. And that would be discovered by microscopic study or vaginal discharge in women and urine in men. There's a picture on page 1099 that you can see. It shows a profuse and watery purulent drainage. Aren't you glad I didn't put it up on the slides? It's just in your book. That's enough. Okay, let's go to HPV, or human papillomavirus. It is the most common STI in the United States, with more than 14 million new cases reported every year. Signs and symptoms are warts, and these is condylomata warts, and they're generally pink or red, soft with a cauliflower appearance. Again, there's a picture in your book that you can take a peek. Medical diagnosis is done through biopsy, and be sure to be screened for cervical cancer, because this is a precursor to cervical cancer. That's why there's a shot that you can get that helps prevent HPV. Medical treatment is removal of these warts or cryotherapy of freezing of the warts, but recurrence rate is very high. There are 2 vaccines that are available, Gardasil and Syphilis. So girls and boys ages 9 through 14 should receive 2 doses. And that's preventative, right? So be sure you get your kids, if you have children in that age, their doses from the doctor. And let them know that this is help preventative for them. You're teaching them good habits. So bacterial vaginosis, caused by Gardnerella vaginalis and other anaerobic bacteria. Anaerobic means what? It can grow without oxygen. So infectious bacteria emerge when normal bacteria in the vagina is suppressed, like if you're on antibiotics. It's associated with having multiple sex partners and douching. And remember, douching clears out the vagina of the natural bacteria that we have that helps us, that prevents us from getting infections. It's unclear if actually transmitted sexually. Signs and symptoms. Let's see, I've got to turn to that page, don't I? So you can read through there, and you can read about preventing complications of bacterial vaginosis. No complications, but it's been documented between bacterial vaginosis and conditions such as PID, which we know can be very painful. All right, and it also mentions that some health experts recommend that all pregnant women be assessed for bacterial vaginosis if they have previously delivered a premature baby. So it is treated with Flagyl, administered orally or vaginally, or the clindamycin vaginal cream. HIV. So HIV gradually destroys T4 lymphocytes. Remember when we read that chapter? And these T4 lymphocytes are essential for resisting pathogens. HIV is transmitted through exposure to body fluids. So we would use standard precautions here. As the lymphocytes decline, the patient increasingly is susceptible to opportunistic infections. Opportunistic infection thrives when the immune system is impaired. So think back to when we were learning about HIV and the CD2 and the CD4 cells. And when the immune system ceases to function, the patient has acquired immunodeficiency syndrome or AIDS. So they start out with HIV, and then once they start getting these opportunistic infections, it turns into AIDS. So let's talk about a question here. Which one of the following statements is not true about sexually transmitted infections? I'll give you a minute here. So it's asking following statements is not true. So the answer is B. Worldwide, the incidence of STIs decrease. No, it increases, right? Okay. Question number 2. A chlamydial infection is usually treated with a single dose of what? The answer is B, azithromycin. So a chlamydial antigen test is used to screen for chlamydial infections. A urine test is also available. The most accurate test, though, is the cell tissue culture. The infection usually is treated with a single dose of azithromycin. So let's talk about assessment, a focused assessment of the patient with a sexually transmitted disease. So of course we're going to do a good focused assessment, and we're going to collect important data to contribute and put on the patient's chart. The health history, we want to know their present history, their present illnesses, and identify high-risk behavior. Now, you're going to have to ask about that. They may not volunteer this information. So I remember when I was working with the AIDS patients, and when HIV first became prominent, these people would have 30 sexual partners a day. So these bathhouses, now they were pretty proud of it at the time, but now it's become kind of a mark. So they may not tell you about all their behavior. We need to talk about their past health history, documenting any serious conditions, their OB history. If the patient is of childbearing age, record the date of the last menstrual period, record recent and current medications. We want to do a review of systems, so we'll get signs and symptoms. So we'll look at weight, change, fever, weakness, fatigue, rashes, any oral lesions that we might see, painful urination. So that's why when we talk to the patient about are they urinating, not only are they urinating, but is it painful? Lesions or lumps in the genitals, vaginal or penile discharge, and altered sexual function. And we want to document any history of blood transfusions, because remember, before AIDS became known about, we were giving blood transfusions. And these blood transfusions were given by patients who had the virus. So some patients got HIV/AIDS through a blood transfusion. So it's important, especially in the older patient that predates when we started screening blood, that you ask this question. The functional assessment, so the frequency and variety of sexual behavior, any IV drug use, past infections, with STIs, sexual contact with a person known to have an STI. We want to determine whether they're at risk because of their age, like an adolescent experimenting with sexuality, if their sexual preference is a man having sex with a man, or their drug habits, victims of sexual abuse, and that's all ages, may have been exposed to STIs. And occupation may also be significant if the patient comes into contact with potentially infected body fluids. Physical exam. So we're going to inspect their skin. And we're going to always palpate and look, check their abdomen. You may have to examine their genitals. I know a lot of patients don't like to show their privates, and that can be the doctor's examination. We want to notice any breaks in the skin or rashes or redness. If you're preparing a patient for an exam, don't expose them before they need to be exposed. So wait until just prior to their exam that you want to get them ready in position for the doctor. And the speculum is usually warm and lubricated before insertion in the vagina, and then tissue and fluid specimens can be taken. And you may be responsible for preparing the specimens and sending it to the lab. In cases of sexual assault, so any of you that work in the ER, this may happen. It's especially important that the examiner be specially trained to deal with such situations. So don't take it all upon yourself. You want to call in resources that can be there to assess the patient, talk to the patient, because they're not going to be really open to a vaginal exam if they've just been abused. So not only does the patient need a great deal of support, but the exam may produce evidence that must be preserved for legal purposes. And I know I've seen some patients will feel dirty and they'll take a shower before coming in, and that's not a good idea, is it? Because it's washing away evidence. So that's one thing you might ask about if they took a shower. You want to note any discharge, color and amount and consistency, and send specimens to the lab. And we always want to label our specimens. I know I keep reiterating this, but collect the specimen. Be sure that you have their name and date and time that you are sending that specimen. And if it has a lid, be sure that the lid, that the body of the specimen has the name, not just the top. So some interventions or safe practices. So there's a table 55.2 that talks about safe practices. So those would be mutual masturbation, closed mouth kissing, body massage, use of own sex devices or toys, possible safe practices: open mouth kissing, vaginal or anal intercourse with properly used condom, oral sex with properly used condom. Unsafe practices: not using a condom, oral sex without a condom, multiple partners, oral anal contact. You can read on. So if we go to the interventions, so that starts on page 1096, disrupted tissue integrity. So they might have a lesion. So assess their skin and report any changes in that lesion. Has the color changed? Has it gotten worse? Has it gotten better? So color, size, and remember, document what you see. Pain is another intervention. HSV, the virus, Herpes Simplex virus, is especially painful. And we also know that shingles, it can progress into shingles later on in life, and that is painful as well. Potential for injury. So if they go untreated, they have that potential for developing the PID or even some cancers. Anxiety. So they're anxious about the outcome of the treatment, potential complications of the disease, also the stigma associated with having an STI. Not that it has to be broadcasted, but it is in the chart. And encourage the patient to verbalize fears and frustrations. So that goes on down to low self-esteem, how they feel about themselves. They may suffer because of a diagnosed STI, and if it was given to them without their knowledge, that's really very hurtful. So encourage the patient to talk about it. Altered social relationships. So if you have an STI, you can't have relationships with other people during that time of infection. So they have altered relationships. And also remember that the STIs must be reported to public health authorities, and they trace all sexual contacts. The patient may also fear reprisals or retribution by a partner that they didn't tell. Impaired sexual function related to fear of transmission. So again, they will be withdrawn, not want to have relations with another person until the infection is cleared. Inadequate coping. They may feel guilt or shame. And then ineffective management of the condition. That's why patient teaching is so important for effective treatment, and be sure they take all of their medicine. And prevention of future infections is important. So, telling them how to avoid infections, how infection is transmitted, safe sex practices, and knowledge. Even though they have the knowledge, they may, in a rush of madness, may not comply. So we want to tell them about information and treatment. And we can give, if you don't feel comfortable talking to the patient about this, you can give them a brochure, or Google has some printouts that you can print out about information for the patient, or they can do it themselves if that's what they feel like doing. Okay. Patient teaching. So be sure that they complete their course of antibiotics, and there is a good patient teaching on page 1097 about sexually transmitted infections. Avoid sexual contact until the infection is cured, and contact with high-risk individuals. So avoid contact with high-risk individuals. The use of a condom. Women with herpes simplex virus are at higher risk of cervical cancer, so they should definitely get annual pap smears. And with HIV, medical treatment may prevent or delay the development of AIDS. So, and if you remember about that chapter 2, it's important for those patients to, once they've started therapy, they need to continue it. They can't stop, or they will get a worse infection the next time. And the patient cannot donate blood if they have HIV. Some other patient teaching that you can do would be the use of a condom and use of dental dam, which is a latex sheet to prevent contact between mouth and vagina or anus. And also patient teaching is important. On page 1098, it has the patient teaching for use of a condom and use of the dental dam. So that's all good to do. Thank you very much.